This short psychoeducational series topic is borderline personality disorder. The Georgia Mind Center. Remember, you deserve peace of mind. This presentation is for informational and educational purposes only. It is not intended to be used as legal, medical, or psychological advice. Although we strive to provide accurate general information, the information presented here is not a substitute for professional advice, and you should not rely solely on this information. Consult with a licensed professional before making a psychiatric, psychological, professional, legal, instructional, and financial or tax-related decision. The topics covered will consist of the following. What is borderline personality disorder? How is it diagnosed? And what are the most common treatments? Borderline personality disorder severely impacts a person's ability to regulate their emotions. This loss of emotional control can increase compulsivity, affect how a person feels about themselves, and impact their relationships with others. Some or all of these symptoms may be present. There could be an effort to avoid real or perceived abandonment, a pattern of intense and unstable relationships with family, friends, and loved ones, a distorted sense of self or a distorted self-image, impulsive behaviors such as spending sprees, unsafe sex practices, substance abuse, reckless driving, and binge eating, self-harming behaviors such as cutting, recurrent thoughts of suicidal behaviors or threats, intense and highly variable moods with episodes lasting from a few hours to a few days, chronic feelings of emptiness, inappropriate intense anger or problems controlling anger, or feelings of disassociation, such as feeling cut off from oneself, observing oneself from outside of one's body, as though things are unreal. Diagnosing borderline personality disorder can be difficult. This is because the symptoms are the same or similar to other mental health conditions. A mental health professional will ask about a person's symptoms and personal and family medical histories, including any history of mental illness or trauma. The Diagnostic and Statistical Manual of Mental Disorders provides criteria that mental health providers use to determine whether or not a collection of symptoms meet the requirement of borderline personality disorder. In the U.S., the prevalence of all personality disorders is approximately 9.1%, and the prevalence of borderline personality disorder is approximately 1.4%. There is hope. Treatment is available. Treatment takes the form of two items: psychotherapy, which takes the form of dialectical behavioral therapy, and there are some medications to address particular symptoms associated with borderline personality disorder. There is hope. Treatment is available. Treatment takes the form of two items: psychotherapy, which takes the form of dialectical behavioral therapy, and there are some medications to address particular symptoms associated with borderline personality disorder. If you or someone you know is in crisis, please call 988 for the National Suicide and Crisis Lifeline. Thank you for watching, and remember, you deserve peace of mind.